G'day, I'm Tom Anthony from Wollonga Physio, and today we're in our Pilates studio because I want to talk to you a bit about clinical Pilates. I want to explain what clinical Pilates is. I want to explain a bit about the difference between clinical Pilates and fitness Pilates, and to give you a couple of examples of who it helps, what sort of people it's really good for. By now you may have heard about how Pilates has helped a friend or another patient that you may know. And so as physiotherapists, I'll explain a little bit about how we use the Pilates to help our patients get moving better. In our first session with someone who presents who's interested in Pilates, we have a one-on-one session that's 40 to 60 minutes long, and that gives us an opportunity to hear their story, to assess the patient and have a look and see how they're moving, and also to check their strengths and weaknesses. Once we've got a bit of an idea of how they're moving, we feel like we can form a hypothesis as to what might have been the problem for this patient. Then what we do is we bring them into the Pilates studio and test that hypothesis, which really is just an educated guess, to see if we can get them moving better. We expect results immediately with clinical Pilates. This is not a long-term thing we wait for before we see results. We'll do an exercise and see if it helps them, then we get that immediate feedback to know if our hypothesis is correct. So, for example, if we had someone who came into physio who'd hurt their lower back, and let's say it's a 40-year-old male who'd hurt his back lifting a trailer, he'd had pain really acute for a couple of weeks, and then it gradually settled down, and now at 6 weeks he's come in. He still has trouble if he's bending over to put his shoes on in the morning. He still has trouble if he's bending over to have a shave or to brush his teeth, and after he's been sitting for a while he finds it a bit hard to get up straight. So diagnostically we may be thinking, and if that fits with all the picture that we've assessed, that this fellow might have hurt a disc in his lower back some 6 weeks ago. He may have sprained some ligaments, but it sounds like his muscles aren't working well to protect him. So for this chap, I'm going to hop on the reformer and we'll show you something we might start with. So you might have to track around. Thanks, Jane. So as a starting point of an exercise, we might set him up on his knees, get him to bend his hips and practice not bending his back. And a lot of blokes we see tend to bend their backs, and that's how he hurt himself in the first place. So we'll see if we can teach him how to control this movement. We'll often tape them a bit to help with that. And what we're going to practice doing is bending and straightening the knees, bending and straightening the hips, bending and straightening the knees. But what you can see when I'm out here in this position is that my back is still and that I'm working my core muscles, and that's what's stopping me heading down and hitting these springs. All our Pilates machines in the clinical Pilates studio are spring-loaded machines, so it's a smooth and even resistance. So we might start a fellow with something like this, and after we've done a few movements, then we'll hop up and reassess the patient and see how that's affected his movement. If it's helped, we think, okay, we can progress it a little more. Another example of an exercise we may choose to do is a similar exercise to that I just showed you on here, and this is a clinical reformer, we call this piece of equipment. Once we've straightened the knees, we might introduce a little bit of extension. Extension being the opposite to flexion, and flexion being how that chap I described had hurt himself. If that makes him feel better when we reassess him, we may then progress him further down to extension. And so it's a little bit like stretching and strengthening the spine all at the same time. There's lots of things as therapists we would do to make sure they're doing that correctly. That's a little quick example of some clinical Pilates exercises we might do for someone who's hurt themselves in flexion. Another typical patient group we might see would be a 55-year-old woman who may have had some children, may have had abdominal surgery, caesareans and or hysterectomy, and really doesn't have a lot of abdominal muscle control. These type of patients traditionally present to physios and chiros once a month because their buttocks are tight and their back's out. They get it stretched or they get it put back in, and then a month later it's out again. So these guys haven't got a good pattern of muscle control that supports them and holds them together. So for these sort of patients, we'd get them doing some exercises initially to try and find where the muscles are that support their lower back, to stop the lower back going out. We use the stability muscles. And an example, once we've shown them how to get those muscles working, and that can take some time. So we may lay them down on this trapeze table and ask them to perform some exercises. Now, in fitness Pilates, often we're in a group setting, we don't have access to these machines, so we're moving in our arms and legs without resistance. But for the patients who are finding it hard to switch on their muscles, resistance, and again that's in the form of spring-loaded equipment, makes it easier to feel what we're wanting them to do. So we would talk to them about the position of their spine and help them feel where we want that position to be, and then we'd get them to work with some gentle exercises against the springs, and making sure that as they do that they're not using the wrong muscles, that they're using a correct pattern of activation. Once they're finding that easier, and that may be the only exercise we do on the first day, we may then make the exercise more challenging by adding in more components, and we can progress these exercises in lots of different ways. I'm just going to pop back onto the reformer and show you another typical exercise we'll do with this type of patient group. Lying on our back is a very nice, stable position, and so we can do some exercises here again to get the muscles working around the spine. This is a comforting position for people who've had lower back pain, and we often, well, I wouldn't say routinely, but very commonly use this little pressure pad, which we can use to monitor the position of the spine. It gives them feedback. We can pump the pressure up in the lordosis of the spine, and we can watch what's happening to the pressure on the pad as they're moving in different positions. So there's a variety of exercises we can use here, and the beautiful thing about this program is that they get the feedback knowing whether they're doing it correctly or not. So again, once things improve and we've reassessed the patient and that they can move better, as I said, we expect them to improve each session when they come so that they walk out better than they came in. We can then progress them through exercises that become more challenging, and that might be over a period of 2 or 3 weeks. So getting someone from being flat on the reformer as I was, to getting somebody upright on the reformer, using the same muscles to make sure we're maintaining good spinal alignment and control, and doing slightly more challenging exercises. So that's a little 2-minute or 3-minute nutshell of what clinical Pilates is and how as physiotherapists we use clinical Pilates. If you'd like more information about this program, please contact our clinic here in Wollonga on 8556 4416. Thank you.